Awesome. Okay, so the first case of measles has been confirmed in Kent County. Is this something that is concerning or surprising to you guys?
I think it's both concerning and not overly surprising. Unfortunately, with the outbreak that we saw in Texas, I think with travel, only a matter of time before we saw the potential spread. Definitely concerning. This is a preventable illness. Anyone can be vaccinated and can prevent measles from spreading.
And I also read that it's the first case since, I believe, 2013 in Michigan. So, how did that spread begin again? I know that it started in Texas, but at least for me growing up, measles was not something that I heard about often, and now the spread has kind of picked back up. Why do you think that that is?
Again, I don't know the specifics of this case other than the individual patient traveled outside of the country. But I think, a more broad picture of what's happening is when we reach the point where we fall under that herd immunity, number of people who are vaccinated, we as a community are susceptible to seeing illnesses like measles, which are preventable, occur again in our communities.
How is measles spread and how contagious is it? Can you just touch on those basics?
Yeah, I think measles is one of those illnesses that really concerns us as emergency physicians because it's incredibly contagious. It can stay in the air for, a long period of time after someone has passed through an area, whether that's a restaurant, airplane who has measles. So incredibly contagious. And one of those illnesses where there's a broad spectrum of illness. People may have very mild illnesses, but it does have serious cases up to and including death, unfortunately.
And is it spread through, is it airborne? Is it through contact? What does that look like?
Yeah, so it's droplet spread illness, and again, it can linger in the air on surfaces for a significant period of time after someone has passed through an area.
And what are the most common symptoms to look out for?
Yeah, measles, like many other illnesses, has common symptoms that we see: fever, red eyes. It has a characteristic rash that often will start on the face and spread. So it can look like other viruses, especially early in the course.
And are there groups of people that are most vulnerable? I know typically it's elderly, infants. Does that run the same for measles as well?
Yeah, measles is an illness that if you're immunocompromised or at the extremes of age, particularly our young children, you're at the highest risk from measles. People born before 1959 are not at risk because they were likely exposed to measles. But again, people who can't be vaccinated for medical reasons, people who are immunocompromised, sick with other illnesses are at the highest risk if they do contract measles.
And you just touched on something that I want to go a little deeper in. Those before, I think you said 1959, are not at risk. Are people who may have had measles in the past, are they not susceptible to it anymore?
Great question. People who've had measles, again, have immunity against the measles. I think, unfortunately, some people may think they have had measles, but maybe it wasn't a true case of measles. So I think the best thing is to make sure that your vaccines are up to date, and if you're concerned at all, to consult with your healthcare provider.
And we talked about in the newsroom this morning how some of my directors had an inoculation for measles. If that's something that people have had in the past, should they be covered? Is there a booster they should look into? What does it look like for them?
A great question. And so after 1989, part of your standard immunizations was a two vaccine set. And so if you were born before then, would be eligible for a booster. And so I think the best thing would be to consult with your healthcare provider to figure out if that's something that you would benefit from.
And you mentioned, maybe people can't get the vaccine for various reasons. What are steps that they should take to keep themselves protected?
Yeah, I think it really starts with someone who's concerned that they might have measles. If you're concerned by your symptoms or exposure and developing symptoms, because this is such an easily spread disease, it's really important that if you're concerned that you have the illness, that you would wear a mask. And if you're seeking healthcare, to immediately let the facility know that you're concerned that you might have measles, because they have precautions that they take to try and prevent the spread to others. As for people who are concerned about getting the measles, standard things, washing your hands, wearing a mask if indicated, are the things that you can do to help protect yourself.
I think those are all of the questions that I have for you. Is there anything else that you think I missed or a good message to get out there for people?
And I think you've hit the biggest things, which is, again, vaccination, vaccination, and vaccination.
I guess one more thing, is this something, we only have 2 cases now in Michigan, but is it something that you expect, because of how easily it spread, those case numbers to rise?
Yeah, I expect that we'll continue to see measles cases, especially with uh, under-vaccinated individuals, allowing it to spread in the community. So I expect that we will unfortunately see more measles cases locally and throughout the United States.
One of the most important things to consider then is to stay up on your vaccinations and be mindful of those.
Yeah, I think the best thing that we can do to protect ourselves and to protect others is to make sure that we're vaccinated, and especially for protecting those who aren't able to receive vaccines for medical reasons. So I think that is the most important thing that individuals can do.